All that good news in mind when it comes to the vaccine, I wanted to invite back on the show a friend of ours, Dr. Ochsenbein, to discuss what this means for our entire nation moving forward in the fight against the coronavirus. Doc, welcome back to Real America.
It's great to be here, Dan. I'm excited to talk about Operation Warp Speed in full success mode.
Yeah, isn't it interesting that we heard for weeks, months from the president, from the vice president who was leading up the task force, that this Operation Warp Speed would get us a vaccine faster than we've ever seen in our country because we cut through all the regulation and BS. We also heard that these therapeutics were amazing. They worked for the president. We would see those. And then you had folks like Governor Cuomo, all these pundits and idiotic hosts on mainstream media going, nope, none of it's going to come till next year. It could be well into 21. Now, a week after the election, poof, we have a vaccine 90% working, going to come out real soon before the end of the year, and therapeutics are going to drop real soon. Somebody told us that. Who was that, Doc?
That's right. That was the president. That was the administration. Unfortunately, it was a negative spin for the last 6 months from a lot of the media with Operation Warp Speed. However, the scientists were watching the studies, and we knew that these studies were going to come out and be a positive light for these new vaccines, new method, fastest in history. Very little side effects. They had a couple of fevers, a little bit of fatigue, which a lot of people have with the flu vaccine anyways. So I'm really excited about this vaccine. Looks like they're going to have about 40 million vials at the end of the year to start divvying out to people like healthcare workers and those who are at highest risk for getting COVID and a severe type of COVID. So right now it's very positive. I wish people would talk about it a little bit more because a lot of the healthcare community is excited about it.
And that's why you're on One America, because we still like giving folks the real news, unlike Fox and the rest of them now, who have an agenda, obviously, to push a Biden presidency and discuss nothing else on their networks 24/7, except that the president should concede there isn't voter fraud. And I think CNN, though, might have brought back up their fear-mongering ticker showing the COVID deaths, but we won't go there. On them.
Yeah, well, there's a lot of speculation with that number as well. I think you've talked about. Well, I don't know if you watched Biden's talk about his mask mandate. I don't know if you saw that, but interesting for your viewers. Recognize he didn't tell you what type of mask to wear. He didn't tell you exactly how to wear it, how to take it off, or where to wear it. And Dan, do you know why that is? Because there's no concrete research on that. Period. So I think it's really funny that the president came out and said, we should wear masks. It's not a bad idea. However, I think mandating is probably not the right time. And then, candidate Biden, his big breakthrough today was everybody should wear masks. So I found that kind of interesting and a little bit disappointing.
I find it interesting. He's going to all of a sudden get a task force ready to go to tackle the coronavirus, and all the stuff that he'd been spewing leading up to the election was stuff that the Trump administration's already put into place. When he's like,
that's right. And that's right. That's exactly why he only brought up the mask stand. And let me tell you what, a lot of the studies on masks were done in hospital settings where people were putting on the mask correctly, taking it off correctly, washing their hands before and after. But what do you see in public right now? Patients are wearing masks like this with below their nose. They're wearing it into their mouth almost like a dog toy. This is not the appropriate way to wear a mask. And yet a lot of the studies that they're trying to push out there for these mandates are not accurate. There's a lot of misinformation. Heck, there was a study from Duke, Dan. Do you know these kind of spandex masks?
Those are horrible.
The neck gaiters.
Those are horrible. Neck gaiters.
Yeah. So there was a study that was in Duke. It said, hey, this mask might actually be disseminating the virus more because it's aerosolizing it when someone sneezes through that.
Yeah.
So are they going to fine an American walking down the street because he's not wearing one of these, but because he's wearing a gaiter that might make it worse? Because the research is not there. So I find it kind of snake oil-like to make these claims.
What, a politician acting like a snake oil salesman? Please, Doc. We all know, I wish we had that clip. We could just pull it up. Maybe they'll get it up there.
Yeah,
Remember the one where...
There's not a physician. Yeah, there's not a physician out there that's going to tell people not to wear a mask. That's all we've got right now. Wear a mask, do some social distancing. However, if people are not wearing masks appropriately, they're touching it all over the place, their nose, they're sharing the masks around. It's defeating the purpose. And we need to make sure that we have appropriate guidelines out there if we're going to tell people they have to wear it.
Yeah, the clip that I wanted to see, and I'm sure folks will remember, it was one of Biden's speeches just days or weeks before the election, and he's up there with his on trying to act very responsible, but then pulls it down when he coughs and sneezes and touches.
And that's a very natural thing. People don't want to be caught in there with all of their
But
sneeze,
that's the
right?
point.
It's a habit to do that.
Right, but then you're defeating the purpose of wearing it. Right?
That's exactly right. So another thing I think a lot of people are frustrated with is they're watching a lot of the celebrations from the some of the numbers coming out from Biden in the streets. They're watching a lot of the protests and the rioting, and a lot of those people were not wearing masks. And yet the media and the Biden coalition did not call those public displays out for spreading events.
No,
However,
they didn't all summer when we had all the riots. They did; those were fine.
That's right. If any other group does it, it's a massive spreader event. So there's people like me watching that, and it's like, well, clearly they're playing sides there. So why am I going to listen to their recommendations? Yeah. And I think that's a reasonable thing for people to think as they're watching all this data come out. And what they need to do is they need to do what's right for them. They need to weigh their own risks and benefits and decide whether they want to wear a mask in public or not. And that's the smart thing to do.
Doc, hate to cut you off there, wrapping me up, but I just want the last 10, 20 seconds here. I want you to reaffirm for folks. So because this was pushed through by the Operation Warp Speed, that doesn't mean any safety guidelines were cut or corners were cut. This is going to be a safe vaccine. These therapeutics are working. This stuff is safe, right?
100%. The FDA, as well as the CDC and multiple organizations, Pfizer and the other organization working on this vaccine did an amazing job. If they say it's safe, I'm willing to take it, and so should you.
All right. Dr. Sean Ochsenbein, thank you for your expertise, man. We appreciate it. Stay safe.
Great, Dan.
Have a great day.
Thanks. You too.
All right, and let me be very clear here as we head to break, if former Vice President Joe Biden becomes the 46th president, he says he's planning on rolling back a whole bunch of Trump's policies on day one. When we return, we'll share exactly what Biden wants to get rid of. Don't go away.